Okay, I am preparing to go live on Facebook. And just takes a couple of clicks to get this thing going. I'm actually pretty excited to share today's topic with everybody. Okay, so go live. I think we are doing this. Okay, so we are live today. Awesome. And welcome to Let's Talk with Camila. I'm very excited to be here. Happy Monday. Happy Mindful Monday. Today, what I wanted to talk to you about is the science of deep breathing and share a couple of different techniques with you. So I know that we hear so much about deep breathing exercises when it comes to meditation and mindfulness. And there are a few different ways that we can practice this. So today I just want to review some of that information with you. So first, let's address why deep breathing is so important and why it's included and incorporated into so many of these activities. Well, what happens when we breathe deep, that is like taking a deep breath in through your nose and right down to your diaphragm, what you're doing is you're generating a high vibrational energy force, or what some traditions call prana or chi. And what I've discovered is that there's a lot of research that supports this kind of deep breathing, that it actually works. You know, one study looked at performing artists and found that their blood pressure and heart rate significantly decreased after just 3 sessions of deep breathing exercises. So that's pretty amazing. Another study focused on Italian patients who had COPD, which is stands for chronic obstructive pulmonary disease, which is a breathing disorder that affects the lungs. And what they found was that their oxygen capacity increased by 20% after only 10 sessions of practicing deep breathing exercises. And that is statistically significant. And another study was done in 2018, and this was published in Frontiers of Human Neurosciences. And what it showed was that slowing down your breathing induces a relaxation response by increasing the alpha waves in the brain. And these are what's responsible for calmness and creativity, and of course, improving your heart rate. So those are amazing results that were, amazing results that were shown from these studies. These changes may translate into less depression, less anger, and less anxiety. Now, there are 4 different techniques that I'd like to share with you in terms of how you do deep breathing. The first one is what we call alternate nostril breathing, which is breathing through one nostril at a time. So what you want to do is cover one side, breathe in through your nostril, and then let go and breathe out through both sides really slowly. Then cover the other side, breathe in, let go, and breathe out through both nostrils. And you want to repeat this at least 5 times or for about a minute or so. Okay. Another deep breathing exercise is one called the 4-7-8 technique, which some of you may already be practicing, which is you're going to inhale, so count to the 4 as you're inhaling, and then hold your breath for a count of 7, and then exhale for a count of 8. And when you are exhaling, you want to purse your lips and do like a whoosh sound, like, okay, for a count of 8. And you want to repeat that 3 times. Another technique is what we call the 7-11 breathing technique, which is you inhale, breathe deeply, inhale through your nose, count for 7 as you're inhaling. And then on exhale, you count 11. Okay, that's the 7-11 technique. And then the last one is called belly breathing, which is you want to lie down on your back, bend your knees, and then place your hands on your belly, not on your chest, but on your belly. And you're going to take a deep breath in through your nose. So you're going to aim to fill the lower lungs or your belly. So you want to see your belly rise as you inhale. Breathe out slowly, and then empty out your belly. And you're going to repeat this for about 10 times or maybe 3 to 5 minutes. And as with all of the breathing techniques that you do, sometimes people feel dizzy if they, do it too deeply or their body's not accustomed to it. So if you're ever feeling uncomfortable or dizzy, then, just stop the activity. Don't keep going. But those are the different, there are obviously more, but those are the most common types of breathing techniques that people do through meditation and mindfulness, okay? Yeah, and that's it for today. So thank you for joining me for that little bit of tidbit for Mindful Mondays. You can always connect with me at letstalkwithcamila.ca. And thank you for joining me. All right, take care. Have a great day.